With the provision of health care being a paramount deliverable of the Liberian government's approach to national growth, Save the Children, one of the key partners of the Ministry of Health and Social Welfare, is eager to ensuring that the post-war nation builds a trained and qualified health workforce, otherwise referred to as Human Resources for Health, HRH for short. An adequate and trained workforce of health practitioners is crucial to meeting the health needs of vulnerable people in hard-to-reach communities across Liberia. As it stands, Liberia is short of health workers according to a WHO standard which states that the minimum number of doctors, nurses and midwives required to deliver basic essential health services is 23 per 10,000 people. Liberia is far away with just 6.6 doctors, nurses and midwives per 10,000 people. With this shortage of a strong and motivated health workforce, Liberians cannot have access to quality health services. That is why the third Global Forum on Human Resources for Health, convened by the Global Health Workforce Alliance (GHWA) and hosted by the government of Brazil, is seen as a true opportunity to discuss and profile the significance of health workers. Increasing the profile of health workers, Save the Children says the forum will look at the UHC agenda and secure new commitments from governments and other development partners to build the health workforces needed to achieve UHC and save children's lives. Save the Children Liberia on 26 September 2013 organized a roundtable in Monrovia ahead of the Brazil meeting with the following objectives: facilitate a national and inclusive dialogue on human resources for health, progress and challenges, raise awareness of the third Global Forum and its relevance post-conflict country like Liberia, secure commitments from government and stakeholders on strengthening health workforces and achieving universal health coverage, and facilitate the reactivation of the National HRH Steering Committee. The Bella Casa Hotel Roundtable had as theme the role of health workers in achieving universal health coverage in Liberia. Diversified stakeholders deliberated on workable mechanisms in bridging the gaps of the scarcity of human resources for dispensing health care to the Liberian people. Welcoming the stakeholders to the dialogues, Save the Children Director for Program Operations, Mercy Gichuhi, called on the Health Ministry to lead a forward march on the recommendations from the roundtable.
We all know that human resource for health is a critical or key pillar for achieving universal health coverage. And in this respect, we would like to commend the government of Liberia and the Ministry of Health and Social Welfare for the efforts and the good work that we have done to ensure that there is increased health workforce in Liberia, and also to expand coverage of essential services in Liberia. We know a lot of effort has gone into that, a lot of planning, a lot of resources, and we also cannot forget the support of the development partners in this effort. However, we would like to also acknowledge that there is both shortage and unequal distribution of health workers in Liberia today, which needs to be looked into.
The hard-working program manager of Save the Children, Dr. Olusola Oladiji, then mounted the podium to provide the overview of the UHC program in Liberia.
The third Global Forum is an opportunity for governments and other development partners to announce new and ambitious commitments and action to build the health forces needed to achieve universal health coverage and save children's lives, including Liberia. With less than 1,000 days left to achieve the MDG goals, and with 6.6 million children under 5 still dying every year, now is the time to act. Why health workers matter? We cannot save children's and mothers' lives or reach the goal of universal health coverage without sufficient numbers of skilled and motivated health workers in place where they are mostly needed. Investment in life-saving medicine, vaccines, technology, can only have the desired impact if we have also investment in health workers who are trained and supported to deliver them. Previous research by Save the Children has shown that a child is 5 times more likely to survive to a 5th birthday if they live in countries with enough doctors, nurses, and midwives. All countries need to invest in a strong health force that is fit to deal with the causes of newborn and child mortality.
Leaping straight into the discussions, Assistant Health Minister for Preventive Services, Tobot Yinswa, keyed in government's delight for such discussions.
That area with high disease burden, but yet the people that are supposed to deliver the services aren't available. So this makes it critical. And then if you talk about the triple burden of disease, which we battle in our region, infectious diseases, maternal and child health issues, maternal mortality. You talk about non-communicable diseases on the rise and emerging, but yet we don't have the kind of human resources to deal with this issue.
The overview of Liberia's human resources for health policy, the role of civil society in the improvement of human resources for health and universal health coverage and expectations of health workers were among key presentations made by panelists at the Roundtable.
Progress, analysis, and conclusion recommendations that will be discussed further. It is in continuation of that, we have the National Health and Social Welfare Policy in the context of the HRH component that is embedded within the National Health and Social Welfare Policy in place for 2011-2021. So we want to intend to improve coherence between strengthening existing workforce in Liberia, the health sector as a whole. Secondly, we want to produce additional workers with the right skill mix. Like someone who mentioned, like Mr. Davidson, and the director, the current director for Save the Children. There's a need to improve by providing more skilled health workers. Deployment based on service delivery needs throughout Liberia and the health sector. Retention of skilled provider where most needed. We need to retain our health workers. This is merely those health workers that are child responsibility, like our CN and our this is what we need to encourage and be retained.
I like to delve into my presentation by starting to look at the policy and to look at a couple of things that I pick up there. First, there is a vision that we want a healthy population with social welfare for all. It is quite an ambitious, vision, and I think we can get there, provided we start by thinking, as the professor has said, thinking out of the box. What do I mean by we thinking out of the box? Looking at the policy in its entirety, I see that the drafters of this policy were still thinking in the box, as the professor rightly said, but not looking at, first of all, what is the inherent problem with the health sector in terms of the way that it is governed. I see that the Ministry of Health and the entire health sector is caught up in its own role that it wants to play. The Ministry of Health wants to play, or have been given the role by law, to play the role of a referee, a player, and a coach. And it's very difficult to do these three things at the same time. providing service, providing regulations, at the same time training people. It's not easy to do all of them and get them in sync. It's difficult. And
we were told during this tour that there's a moratorium on the employment of staff, skilled providers. But quite recently, I was also told that the moratorium on employment is no longer in force.
We will begin by saying that the objective of the individual members is to save life and provide comfort for those in need, irrespective of political background, ethnic dimension, religious affiliation, and the like, which is being transformed into the organizational objective. Let me quickly note that it was due to the passion for this profession that during the war years, when all other professional bodies were not around, we took the time to the very detriment of our lives. Today, we are staying in the vanguard for this very cause, even though we are the very least paid. Our children do not attend humanitarian workers' school, nor do we buy from humanitarian workers' school. Notwithstanding from what the National Health Workers Association members are going through in their various places of assignment, is what motivates that we remain resolute to our duties. It is saddening to know that one is trained and willing to carry out his or her duty, yet they require materials or medication to save life aren't available.
There should be a moratorium on institutions of training. There should be a moratorium and close it and make it better. 14 training institutions in this small country is more than enough. And yet every day, every community college wants a training institution. I agree they should be strategic. I agree that it's difficult for people to come in from Sino, from these places. But the fact is, and I said it from before, when the war came, and we had the 8 institutions who were there before, they should have really made them strong. They really should have made them all strong and put out quality health force and then hire them. But instead, everybody and his mother and brother wants to open up a nursing school. Excuse me, it cannot be possible.
A communique was then developed and read as a way forward to improving the human resource for health situation in Liberia.
The Ministry of Health and Social Welfare to coordinate effectively with the Ministry of Finance, the Ministry of Planning, Civil Service Agency, the legislature, so as to ensure adequate funds is allocated to the implementation of the HRH policy and plan, source funding from domestic resources, private sector donors, organizations. The training institution of Liberia should be regulated and closely monitored to ensure they produce the needed number of health workers with right skills and quality.
Stakeholders to the deliberations included local and international partners, relevant UN agencies, donor agencies, civil society, and the media, the Health Ministry, the Health Workers Association, the Press Union of Liberia, and the Liberia Medical and Dental Council. Others were the A.M. Dougherty College of Medicine at the University of Liberia, the Liberia Business Association, and the Catholic Justice and Peace Commission.